Pain with sex is normal. Get out of here. Unless you want it to be painful, like you're into that, good for you. It should absolutely not be painful, only enjoyable. So if somebody tells you it is normal, you look them dead in the eye and say, I don't know what planet you're from, but pain should not come with sex. Okay? Just orgasms. Hey guys, Allie here. Today we are busting some pelvic floor myths, the ones that keep women confused, ashamed, or stuck in silence. And to prepare for this, I gotta get me a nice drink. This is not medical advice, but if you're looking for something tasty and may or may not help you poop, Poppy. No, it's not an ad, but they can sponsor me if they want to. Okay, and this is orange cream and it literally tastes like a creamsicle. So we are talking about myths that have to do with urination, bowel movements, sex, pain, pregnancy, postpartum. Today, my goal is to help normalize, educate, and empower you to tell that person, no, that's not normal, but it is common, because that is how we should phrase things. We're not alone. Most people have these challenges, and that's why it can seem normal, but it's not. So if you listen to this, or you feel like you know somebody that needs to listen to this, please let them know or share this episode so that they no longer feel like it is normal when it's not. Okay? So I wrote down all the craziest things either I personally have heard from a provider, or my patients have told me, or have told my other therapists. So I will go and tell you the myth, and then I'm going to educate you on why it's not normal. So first category, urination. You just have a small bladder. That's why you pee a lot. False. Okay? First of all, anatomically, you most likely do not have a small bladder, but what you have done is train your bladder to be small. And what I mean by that is that our bladder gives us 3 times it lets us know you have to go to the bathroom. First time, it's letting us know it's 1/3 of the way full. You don't have to go then, okay? Second time, it's 2/3 of the way full. That's when we should go, because the third time is, hello, I am all the way full. You are going to pee your pants. So what typically happens is people can't differentiate between those, and they go a ton on that, hey, I'm just 1/3 of the way full. Now we've told our bladder it really can't get more full. So now it seems as if we have a small bladder. Okay? False. Myth number 1. Peeing your pants when you sneeze, laugh, or cough is normal after having a baby. Absolutely not. Absolutely is not normal. It is very common. And I was told it from a little girl on, from my mom, my aunts, my grandmas. Oh, you just wait. When you have a baby, you'll pee too, just a little. And you see them literally cross their legs out in public. They are laughing so hard they have to cross their legs, or they're going to sneeze, and you see that leg cross. And you're like, oh my goodness, we got to get that person some pelvic floor help, right? It is not normal, but it's very common. Just in case peeing is good for your health. And what I mean by just in case peeing is like, before you leave the house and run errands, you're going to pee. Just because you don't know when there'll be another bathroom, or you're going on a road trip, so you better pee because you don't know when there's going to be a bathroom, or you don't really want to stop. Okay, that myth, bad, and kind of relates to the first one I talked about. If we go just in case all the time, our body feels like it cannot maintain the amount of urine it should. And if you go just in case, then what happens is some people will get home and they're putting their key in the door, or they touch the door handle and their body's like, I have to go to the bathroom. But like when you were driving, you have to go to the bathroom, but then you're like, holy shit, I have to go to the bathroom. And you are literally like doing the potty dance at the door because your brain is like, hey, there's a bathroom in there. I can go to the bathroom. That can happen because of just in case peeing. Or how many people go to the bathroom in the middle of the night? You wake up and you're like, man, do I have to go to the bathroom? I don't know if I have to go to the bathroom, but but I'm going to go to the bathroom because I sure as heck am not going to fall back asleep, wake up again, and go to the bathroom. So I'm just going to go right now. Okay. Lots of habits and routines we need to change there. So not good. Next one. The more water you drink, the more you will pee. Not true. Now, if this is your first week, 2 weeks that you're like, I'm really getting in all the water I need to up my water intake. Okay, I'll let it fly. All right. But if you've been doing the same amount of water for like 2 months, your body should be used to it. You should not be peeing. In fact, I am going to let you know that if you are not pregnant, you should be able to hold your urine for 3 to 4 hours before you go again. 3 to 4 hours, not every hour, not every hour and a half, 2 hours. And sure as heck, not multiple times an hour, 3 to 4 hours. If you heard that and you're like, oh my goodness, reach out. Okay. You need to push your pee out. Okay. I don't even know why somebody said that, but you should not push your pee out. Okay. No, we need to relax to allow our pee to come out and fully empty. All right. Jumping and peeing after a baby is normal. No, it's not. You should be able to go on that trampoline with your kid and jump and not feel like you're going to pee or feel like it's heavy or something's falling out. God forbid. You should be able to jump. It's not normal, but it is common. I don't know how many people talk about like, I ain't getting on that trampoline. I'm going to pee my pants. All right. So peeing in the shower. Okay. I have a little mixed relationship with this one because some people will say, do not pee in the shower, because what can happen is if you relax and pee while there's water going, then it can kind of trigger your mind anytime that it hears water that you have to go to the bathroom. So typically we don't really like when people pee in the shower. However, some of my patients, if they have a really hard time relaxing to pee, I may suggest trying to do it in the shower to relax their mind and body to fully empty. It's a very case by case because I do not want it to be triggering. You must give up all coffee, caffeine, alcohol if you have to pee all the time. Okay, absolutely not. Okay, they are irritators. And so we do got to figure it out because, you don't want to be peeing all the time or have leakage. But we don't have to automatically say like, let's cut it out so that you can't have it. Okay. There's lots of different tricks that we do with that. One of my favorite ones, and I don't have research behind this, and this isn't medical advice, but if you have a spoonful of protein or peanut butter before you have coffee in the morning, you'll have less irritation. It's worked for so many of my patients. All right. Next one, we're moving on to poop, bowel movements. Okay. Pushing your poop out is normal. Nope. Don't bear down. Don't push your poop out. I don't care how big it is. You need to relax and let the poop pull itself out. Okay. Going once a week is normal. It's not. No. So what we prefer as pelvic floor therapists is 3 times a day. You had 3 meals in, 3 meals out. That isn't always true for most people. We really like at least once a day. But you should be going anywhere from 3 times a day to every 3 days. Now, with that comes my next thing of if you're pooping, you're not constipated. That is also not true because you can be pooping and still be constipated, especially if you fluctuate between rabbit turds and liquid or mush, right? That's telling us that it is not clearing properly. So bowel movements play a huge role in pelvic floor, more than people want to give it credit, but it really does. We'll dig into that. MiraLax for life, like a MiraLax regimen that you are on for a long period of time. We don't want that. That, first of all, doesn't taste good. Second of all, that's not getting to the root cause or problem. It's just like putting a Band-Aid on it. Here you go. Now, do we need to use it sometimes to help get things going? Absolutely. But it should not be the long-term solution. If you have fecal leakage, There's no hope and you must have surgery. I had a patient tell me that, and I was so sad for them. First of all, they're young mom. And second, I'm not saying surgery is not necessary, but isn't there other things we can try first before a scare tactic? Can't we try and see, is something going on with the pelvic floor? Or if we've got too much tone, too little of tone, we're not coordinated, is there a sensory issue that we need to address? Surgery should not always be the first response. Now, there are obviously exceptions, but there are things that can be looked at and tried prior, okay? Constipation doesn't have to do with your pelvic floor. Okay, pelvic floor absolutely plays like hand in hand with constipation. If you are listening to this and you have been told you have a prolapse, or sometimes you're having a bowel movement and you're like, I can kind of feel something by my vaginal opening. What is that? It's because they're so connected. The pelvic floor is like a toilet bowl, okay? And they play off of each other. And if you're constipated and it's just put all this pressure on your sphincter, what do you think it's doing to the rest of your pelvic floor, right? Or vice versa, you've got so much tone in your pelvic floor and it's just so tight. What do you think it's doing to your sphincter? It's not going to allow that poop to come out very nicely, right? So not normal. All of these things, though, remember, common. A lot of people also experience this, okay? Next up, sex and pain. I kind of put them in the same category, unfortunately. Pain with sex is normal. Get out of here. Unless you want it to be painful, like you're into that, good for you. It should absolutely not be painful, only enjoyable. So if somebody tells you it is normal, you look them dead in the eye and say, I don't know what planet you're from, but pain should not come with sex. Okay? Just orgasms. Drink a glass of wine to relax. I know that I'm not the only woman that has heard that from their provider. And that just like opens a whole can of worms. Like, first of all, should we be telling people to have a glass of wine to relax so that they can engage in sex? That seems pretty messy to me. So don't do that. You are having pain because it's just the position. If you just change the position. Okay, first of all, it is true there are certain positions for people with pelvic floor dysfunction that can have more of an effect and exacerbate the pain. Not normal. We should be able to have whatever position we want, do it in whatever position we want without pain. Not normal. You just have to get used to it. I don't even know what to say about that one. You just have to get used to it. Again, isn't this supposed to be an act of fun? Spiciness in a great way. And like pleasure, like get used to it. What does that do to someone's mental health? Let me just get used to it. Let me just lay here, let my body take this pain and get used to it. No. If it doesn't hurt to insert a tampon, it shouldn't hurt when a penis goes in. Those are different sizes and not correct. There's also so much more to that, which leads me into it's just physical and not mental, or it's just mental and not physical. My biggest thing I like to tell people is the pelvic floor is not just physical. It's very psychosocial, emotional, and trauma-filled. And they play off of each other. We don't know which came first, like the chicken or the egg, okay? So it all has to do with it. And you could be very ready to have sex with your partner, and you're in the act, you're turned on, you're ready, and then they come and your body's like, nope, absolutely not. What are you supposed to do? Just tell your mind, calm down. Well, your mind was in it, but your body said no. Okay? If you don't use it, you lose it. I have had so many menopausal women come in and tell me they were told that by a doctor. If you don't use it, you lose it. What? First of all, we use our pelvic floor literally for every point in the day. Sitting, walking, standing, going to the bathroom, pooping, sleeping, engaging in sex. We literally use our pelvis for everything. So I don't even know how you can say if you don't use it, you lose it. Maybe we should address the challenges that come with menopause, not just use it or lose it. If you're not having orgasms, you must not be turned on, or they're not doing something right. What? First of all, I don't know about you listening right now, but I have thousands of tabs open in my brain all the time. Pretty exhausting. Orgasms have a lot to do with mental and physical, but here's the thing. To achieve an orgasm, our body has to contract, relax. The orgasm happens on that relax. I don't know how many of you listening have ever been having intercourse and you're like, all right, I'm there. Why isn't it happening? Come on. Because you can't relax. So you're at the tippy top, but you can't complete because you cannot relax your mind and your body. That doesn't mean you're not turned on. That doesn't mean your partner's not doing it right. Hello, that means we need to work on relaxing, okay? If you need lube, your partner is not doing their job. Okay, first of all, everybody should be using lube, okay? Do not be scared of lube. Spit is not lube, okay? Lube helps things go in and out way better, all right? And my favorite three are Uber Lube, Slippery Stuff, and Good Clean Love. Those are my three favorite products to recommend, and they're all good, clean ingredients. Highly recommend them. Everybody should use lube. Don't be scared of it. And please don't use any that are flavored or gonna burn or cool in heat, or those are not good for us. All right. All right, moving on. Pregnancy and postpartum. Pain is normal during pregnancy. I don't know about you, but pain shouldn't be normal at any point of the day or any point of life. Like, pain is not normal, common, and definitely common during pregnancy. Back pain, foot pain, neck pain, rib pain, you name it. There's lots of pains that come with being pregnant, but it's not normal. Nothing can be done for pubic symphysis dysfunction, or some people like to call it lightning crotch. You move and you're like, oh, ow, that hurt, or you move this way, or you get out of bed, or you get out of the car, you get out of the bath. You're like, oh my goodness. That is not normal. And there can be things done to help decrease, if not eliminate, that during pregnancy. However, some providers or some people will tell you that the only way to get rid of it is to deliver the baby. We've got some other techniques and tricks to do, okay? We don't just have to gotta live with this until have this baby in 20 weeks. You don't need pelvic floor during pregnancy, only after. Not true. First of all, I just talked about having pain is not normal. Pubic symphysis, not normal. Also preparing for labor and delivery, right? I will be the first one to tell you that my first birth, I thought everybody has a baby every day. You just push a baby out, right? Like normal. I wish I would have prepared. I absolutely wish I would have prepared. If I would have known more about my pelvic floor, how to relax it, how to get in certain positions, I would have been in a much better position. There is nothing you can do to prepare for a C-section. Also, very incorrect. Yes, you may not be pushing a baby through your vaginal canal, but you are about to have 7 layers cut into. We absolutely can prepare you for that. First of all, we're going to talk about techniques to do after leaving the hospital, because you're not going to be able to just get up and move in the ways that you're used to. So how can we prepare for that? But second, we can also prepare that abdomen, thoracic region for that surgery, okay? And make you stronger and understand better and advocate. So, and then afterwards, we absolutely need pelvic floor therapy. And even though you didn't push a baby through your vaginal canal, you now have a scar going across your body that we need to work on. And that affects our pelvic floor. Sometimes my C-section moms are the ones that need pelvic floor more than anybody else. First of all, there are a lot of mental components to that, especially if it wasn't planned and it was emergent, okay? I could go on and on about C-sections. That'll be another episode. Okay. You must do lots of crunches to prevent or heal DRA. DRA, diastasis recti abdominis. That separation in your abs that people talk about. We do not want to be doing crunches. Okay. In fact, I'll tell you one of the biggest ways to help with that, first, to help prevent it from happening and decrease or heal it, decrease it like getting worse or healing it, is learning how to properly breathe and engaging that deep transverse abdominal muscles. You can't lift heavy when you're pregnant. Lifting, there's a lot of research on lifting is so good for you when you are pregnant. So good. All right, this is my one that I have heard is still being told in some birth prep classes. Do 100 Kegels a day to prepare for childbirth to make your pelvic floor stronger. I literally have no words for that. No words. 100 Kegels? First of all, your pelvic floor doesn't push your baby out. It's got to relax and get out of the way. No. Just no. Okay? If you're doing Kegels while you're pregnant, unless a pelvic floor therapist has told you to do that, which again, I'd be wondering why, but I'm not going to question everything. Don't do it. Don't do it because a social media person told you to. Okay? If you listened to my first episode, you learned a little bit of why I started One Strong Woman Therapy and now have Vaginal Speaking. It's from my own experiences. So my two crazy things I heard postpartum. One, I had significant pain with intercourse and never had pain with intercourse prior to having our daughter. And I was told literally to have a glass of wine. I don't need to have a glass of wine to want to have sex with my husband. There's got to be something else. The second thing is I had this chronic itching and burning. I mean, so uncomfortable. And I would go to the doctor and they would check me for everything. They'd check me UTI, yeast infection, STDs. And then they would just say, I guess this is your new norm. What? What do you mean that's my new norm? Itching my crotch? Absolutely not. Come to find out, with all of that, I had a very hypertonic pelvic floor. And I was never told that the scar where I tore delivering my daughter needed to be worked on just like any other scar on my body. When I started going to pelvic floor therapy, things got better. Now, if you're wondering, of all the stuff I talked about, what is all the stuff pelvic floor therapists can work on? You can download the free downloadable that I have that talks about all the stuff pelvic floor can help with. And if you see something on there that you fall into, go ahead and reach out to us. Because, girl, you don't need to be hitting that list. You need to be feeling more like you and on your own healing journey. Okay? So, to wrap it up, we are going to unlearn that shame that we have been told that these things are normal, when indeed they're not. They're common. We're going to stay curious and advocate for our body. You're going to DM me if you feel like you have a favorite myth I talked about, or the craziest thing you were told by a provider that was normal, when now you're like, I don't think that is. All right. So I hope you enjoyed hearing what is common, not normal, and how we can go about it. And if, again, this sounds like something one of your girlfriends could benefit from, because we are out here to spread the word, pass it on, please. Tag them. Give me a review. Follow One Strong Woman Therapy. Let's help the women out in our circles, okay? And just a little let you know, the next episode is me and one of my dear friends, another amazing pelvic floor therapist, going at it, talking about all these things and what we wish people knew. All right, so give me a follow and I'll see you at the next episode.